Welcome back, 9:12 right now. On the Health Watch, it's an eye-opening study about these devices that can track your sleep. Now, some doctors recommend a sleep tracker when someone's having trouble getting a good night's rest. But according to some new research, those trackers may also be part of the problem. A report published by researchers at Rush University Medical Center in Chicago showed that sleep trackers actually cause people to lose sleep over the fear of losing sleep.
We found that people were anxious about their sleep and trying to get a specific number. And in trying to get that number, they were doing things that were interfering with actually having good sleep, like doing things like laying in bed, trying to make it add up to this like 8 hours.
So we're basically freaking ourselves out, right? Researchers say one should monitor how one feels. And if you don't feel rested, then you should add more time to your sleep schedule. Being fixated on a number is not going to help you in the long run because sleep cannot be perfect every single day. We're freaking ourselves out. And joining us this morning in today's Healthy Living House Calls, sponsored by Florida Hospital, is Dr. Cheryl O. Good to see you, Doc. How are you?
Good to see you, Amy. How are you doing?
I'm good, thanks. Okay, so does this surprise you that we're freaking ourselves out? We're stressing so much about how much sleep we're getting that we're actually causing ourselves to lose sleep.
That's right. And you know, the best thing is like the harder you try, the harder you can go to sleep. So the best thing is, I always tell my patients, let it be. You know, even if you can't sleep, just I'm just going to be resting in my bed. And when you kind of let that go, you eventually just go to sleep by itself, and you have to relax and let it go and take it easy.
One of the things I've heard, Doc, and tell me if this is true, is that if you're laying in bed and you're just laying there and you're counting sheep and you can't fall asleep, that you should just get up and go do something else until you feel tired. Do you like that advice or no?
Correct.
Okay.
Because otherwise you ended up tossing and turning in bed and you just don't go to sleep because of that. You know, you have to just take it easy. Even if you don't go to sleep, you just tell yourself, let it be. I'm just going to be resting here, you know.
Okay.
And that's important.
What about these sleep trackers? Do you like them? What do you tell your patients?
Sleep trackers is important because in the past we have this gadget that we can apply to patients. But, you know, because the insurance reimbursement problem, nobody want to pay for it. Insurance doesn't want to pay for it. So we have a hard time doing that. And I'm so happy that finally we have a sleep trackers now. And the best thing is, you know, don't worry about that gadget. Just let it be. Just live your life, you know. And when it is, it is. And you know that if you don't have enough sleep, just make a priority to have enough sleep, because that really affects your health, affects your intelligence, you know, and affects your well-being.
Sure. All right, Doc, so what do we need to know when it's time to go see an expert like yourself?
Well, quite a few people coming in because they, you know, I'm also a primary care doctor, so they come in to say, Doc, you know, I'm so tired. You know, I don't know what happened. As much as sleep I can, I just don't feel refreshed. Another big problem is insomnia. In this society, when a lot of demand are put on us, people have a hard time sleeping. Actually, that's a biggest problem in the society.
Right, right. Okay, so Dr. O is actually going to stick around and answer your questions. So viewers, if you have questions about your sleep health, you're not getting enough, and maybe you're worried about your kids, that's something else that Dr. O can answer questions about. All you have to do is go to our website, fox35orlando.com/health. You can post your question there, and we're going to check back in with Dr. O in just a little bit, see what kinds of questions you've been asking. Dr. O, great job. Thanks for being here.